Hi, my name is Nick Pappas. I'm a physician with Steadman Hawkins Clinic of the Carolinas, Greenville Hospital System. My specialty is hand and upper extremity surgery. I grew up in New Orleans. I went to college at Princeton, and after Princeton I went to Vanderbilt for medical school. And then after medical school I went to the University of Pennsylvania in Philadelphia for my residency in orthopedic surgery. And then after that I went back to Vanderbilt for a fellowship in hand, microvascular, and upper extremity surgery. As a hand surgeon, I take care of a wide variety of different problems of the hand and upper extremity, from microvascular surgery, which involves reattaching arteries and putting back on amputated digits, to reconstructive surgery for arthritis. I do replacement of the small joints of the hand, as well as arthroplasty for the thumb, as well as partial wrist arthroplasties and elbow replacements. I always grew up with a lot of people in medicine in my family. My father was a physician, my grandfather was a physician, and so I'd always had it around me. And I used to go to the hospital with them when I was younger and kind of enjoyed their lifestyle and what they were able to do for people, and that sort of started my interest. So growing up I played several sports, basketball and baseball. Baseball became more of a focus for me as I came into high school, and as a junior and senior. I started looking to play baseball in college, and actually played college baseball at Princeton, where I was part of a couple teams that won Ivy League championships, and we actually played in the NCAA tournament regional finals, which was interesting and a great experience. And you know, that interest in sports, I was a pitcher. You know, I had arm problems, so I did visit the orthopedic surgeon pretty frequently, you know, while I was in college, and so that kind of once again sparked my interest a little bit in that field. Most things, particularly in orthopedics, can be started off with non-operative treatments. So I try to exhaust everything non-operative first. You know, with physical therapy, we have certified hand therapists through ProAxis that we use, and you know, we try to exhaust everything else and do surgery as a last resort, because there's always the ability to do surgery. You know, if you come in with a trigger finger or carpal tunnel syndrome, you know, I can do other things before we jump straight to surgery. Sometimes surgery may be necessary sooner than later, but for the most part, we try to exhaust all non-operative means first. A lot of times people complain that they go to the doctor and they're not really sure what they were diagnosed with, what their options were, and they really just wanted somebody to tell them exactly what's going on and at least give them some choice in terms of the matter. I think you know, I try to just put it in as plain terms as possible. You know, whenever they have a condition, try not to overcomplicate it and just tell them all the options. I try not to tell them what to do. Occasionally, you know, you do want to steer people in the right direction, but you really ultimately want to give them the decision in terms of whether to pursue surgery or to continue other means of treatment. In my spare time, I enjoy a lot of sports. Pretty much anything football or baseball related. You know, I usually will watch, or you know, if there's a sports team nearby, you know, like the Braves in Atlanta or Carolina Panthers, I'll, you know, try to drive down and see those games. Certainly anything that's on TV, baseball or football related, I will watch. And you know, those are probably two of my biggest hobbies. Also enjoy, you know, weightlifting and working out and that sort of thing, but sports are kind of what I really enjoy. Probably the most rewarding thing about being a physician, particularly in our field of orthopedics, is basically the ability to take people with a pretty significant problem and either through surgery or therapy, try to restore them back to their normal life. It's more of an immediate reward in our field than other fields, as you know, opposed to fields where you're controlling blood pressure or doing things that are more, you know, chronic conditions. We can sometimes take people you know, with a fracture or some sort of other, you know, serious traumatic injury, and you know, get them back to pretty much normal. So that's pretty rewarding and a little bit different, you know, than other fields of medicine.